Welcome to Learning Unit number 3. In this learning unit, we're talking about stigma and mental illness, really focusing on depression and anxiety, and about incorporating mindfulness. So when you click on this learning unit, you're watching the welcome. You're watching the introduction video that goes over everything that you're going to need to do. And you're looking at the topic descriptions. What are our objectives? What are our learning assignments? So by the end of this learning module, these are the learning objectives. You can read about that. And by Sunday, there are a number, and it looks kind of overwhelming, but I tell you, they're really brief and they go from one to the other, and you can complete almost all of these reading assignments, videos, in a very short period of time. So I'm not going to go through each one, but I am going to tell you that we're going to end with watching the video about how to do your herbal presentation. It's going to be in the assignment tab. Now that's not due until week 6, but I wanted to give you, I know some of you like to work early on your assignments. I wanted to give you some time. So we'll go over that in a minute. But let's look at what we're going to do. You're first going to read just very short, succinct information about depression. What are the symptoms? Who gets it? That kind of deal. And that came from the Centers for Disease Control, the CDC, in 2023. So I cited, that's where I got this information from. And then you're going to watch a video about a young woman who at the time was just applying for colleges. She was talking about her own her own experience with her chronic illness, which was depression, and how it did go along with anxiety as well, and the stigma that still surrounds mental illness and mental health concerns. You're next going to, so you just click on here and it will take you right to the video you'll see in the next, when it opens the next page. And then there's the PHQ-9 is what we call it, the Patient Health Questionnaire. And this is used very often in primary care providers' offices, etc. And it's a very quick tool, a screening tool for depression. So I ask that you, the best way to learn about an illness such as depression is to look at the questions that are asked on these screening tools. So I want you to complete it. If you feel totally uncomfortable with completing it, I'll never see your results. Nobody else is going to see your results at all. But after you complete it, or ask a friend to complete it. Again, it's very quick. If you look at it here, it's going to be a PDF file that you can open, but it is the best way to understand the disease, the illness that we are asking someone to be screened for. So that's going to be a very quick thing. Again, it's 9 questions, very quick. Then you're going to read a very brief on nursing students, you, and the experience of depression and anxiety, and the prevalence, the numbers of nursing students that are experiencing depression and anxiety, along with, overall college students, much higher rate, but or that age group of college students, a much higher rate. But this is specific to nursing students. So I want you to be aware of the high rate of depression and anxiety. And the reason is not to discourage you or worry you. The reason is to know that we can do something about both preventing and helping those that do have depression and anxiety, a lifestyle change which is mindfulness in nursing. Now, that might not be all. I do not say that at all. Depression, there are a lot of medications. You would want to talk to a counselor, a physician, and be treated, especially if your PHQ shows high. But what I'm saying is, along with its multimodal, that means there's different ways of combining treatment for both counseling, maybe counseling plus medication, maybe counseling plus mindfulness. But overall, there is something the individual can do in addition to seeking out treatment, and that's mindfulness. So we're going to make that a part of this course. I do believe the literature supports that mindfulness is extremely effective in helping us focus, improving sleep, so many things that you're going to learn about. Becoming aware of the present moment. So you're going to learn more about that in this course because it's a fantastic coping mechanism for the stressors of both nursing and college and life in general. So we need those coping mechanisms. And some of you have already developed a practice of mindfulness, but many have not. So it is a focus of this course. And then we're going to, after we've taken you from being worried to, yes, there is something we can do, to knowing about there's an ethical concern because nurses who do experience depression, etc., have a higher and anxiety, have a higher rate of making medical errors. And that's concerning, isn't it? None of us want to make a medical error. None of us want to harm a patient. So that's the other reason mindfulness is so important, and removing the stigma of mental health concerns, mental illness, removing that stigma so everyone gets the proper care that they need. I'm passionate about this because it is huge in nursing, that we need to provide nurses with support. We need to make sure that nurses have the coping mechanisms to deal with the profession of nursing and in life in general. So this is going to be Bernadette Melnick is a nurse researcher. She's extremely high-level nurse researcher, and she is has done a lot of studies along with other authors about nursing and about mental health concerns, staffing ratios, you name it. She has done a lot. So you're going to click on here. You're going to read what is pretty brief here. It's not that long, but I want you to get to meet Bernadette Melnick, and I want you to watch this video again. I think it's 3 minutes, and it will explain a bit better about the information here. So that is a big part. But again, it's probably taking me as long to go through this as it will take you. But this is good information. It's helpful information. It's pertinent information for nursing students, And then this is optional, but it's a short little video about 1 moment meditation. So if you want to get it into more practice, here's a nice little meditation. This is not optional. This is, again, the continuation of the use of your Smiling Mind app. And there's going to be 3 minutes of 2 different audios that you're going to listen to on your Smiling Mind app. So pretty quick, pretty easy, but to help us learn more about meditation. And there is a quiz. Now, this quiz is not timed. Again, it needs to be completed in 1 sitting. So when you click on the quiz, be ready to finish that quiz no matter how long it takes you. There is no time limit. and it's going to test your knowledge about all these learning activities. I wouldn't be going crazy taking huge amount of notes, but there is going to be information coming from each. And I believe you will do just fine if you have mindfully been aware and as you went through these learning activities. And finally, you're going to finish with discussion board 3. Please know that for this one, you do not need to reply to a classmate. Therefore, it's not going to be due until Sunday night. But please know it's still worth a total of 30 points. So all the points are coming from your original post. So based on the results of a study done by Bernadette Melnick and others, that's what et al. Means. So Melnick et al. In 2021, an ethical concern for nurses is raised. Her study demonstrates that nurses with depression are more likely to make medical errors. So the findings of the study are even more concerning when we see a significant number of nursing students and nurses experiencing feelings of depression. So mindfulness, as I've said, is one strategy that can be used to address this concern. So you're going to answer 2 questions. What would you, based on what you've learned so far, maybe experienced in life in general, but what would you recommend to the nursing faculty, me, other nursing faculty, professors at Mercyhurst University? What's your recommendation based on the information that you reviewed this week? So you know that nursing students have a high rate of depression. What's your recommendation about how can we help? What can we do? And why? And make it doable, because I know you'd all like to have less classes, very easy classes, you name it, but we are preparing you to sit for a licensure exam, and unfortunately, there is rigor to this program. I mean, it just has to be for nurses. So make it realistic, but based on what you've learned this semester or learned in this unit, especially. What's your recommendation? And are there resources that would be helpful to you that you would like to see at Mercyhurst? Maybe we don't have a great resource that you come up with. And then the second part is, have you witnessed stigma surrounding depression and anxiety as the college-bound student, I think her name was Allie, noted in her TEDx talk? So that one video you're watching is about Allie, and she gives a TEDx talk. So have you also witnessed the stigma surrounding depression and anxiety? Now, please note that even though you don't have to reply to a colleague, your information is made public in this course, right? So there's 15 other students that are going to see what you wrote. So I'm not asking you to provide any personal information. I'm not asking you to say, hey, on the PHQ 9 survey, I did this. I'm just asking you to think about you as or all nursing students at Mercyhurst and other ways you think we can improve to help students deal with depression and anxiety. So that's it. And I hope you have a great week. I know sometimes this information can be concerning to a student new in nursing, but we can do something about it and we can support one another. And we want to start by supporting and making sure all nursing students here at Mercyhurst University are supported. So thank you and have a great day and a great week.